We actually presented some data looking at the role of allogeneic transplant in patients that have received pembrolizumab in relapsed or refractory classical Hodgkin's lymphoma. By way of background, we know that patients are still being considered for allogeneic stem cell transplant in this disease because it is a potentially curative treatment, but there were some early reports that came up that suggested higher rates of toxicity, particularly both acute and chronic graft-versus-host disease in patients that have received checkpoint inhibitors. And so the purpose of this analysis was to take patients from some of the early studies looking at pembrolizumab and the more recent registrational studies and really try to characterize the outcomes of the patients that had allotransplants. What the data showed, firstly, was that from an efficacy standpoint, these patients appeared to do really well, and so their progression-free and overall survival compares favorably with what is published in the literature. From a toxicity standpoint, we also saw that acute and chronic graft-versus-host disease rates looked reasonable, but there's maybe a suggestion there that there's a higher proportion of patients that develop significant acute graft-versus-host disease against historical controls. The challenge with this type of analysis, though, is that there are patients that are being treated in a very heterogeneous manner, not on a prospective clinical trial in terms of the allotransplant. So significant variety in terms of type of donor, use of GvH prophylaxis strategy, and those sorts of things, which makes it a little difficult to draw strong conclusions. But there was no major signal that there needs to be a concern about safety. And we know from a practical standpoint, at the end of the day, for clinicians, a very common approach in this setting is just to have a bit of a window post the last dose of a checkpoint inhibitor before they proceed to allogeneic transplant, and typically this can be done quite safely.